Hi everyone, the topic for today's module is diagnosis and management of canine pancreatitis. And once again, this is a canine medicine course, but where relevant, we will just briefly mention what happens in cats just to compare and contrast where it's important to do so. So in order to understand pancreatitis, we have to understand how the pancreas works, and it really is an incredibly clever organ. So the pancreas secretes pancreatic enzymes, and these enzymes effectively can digest most tissue in your body. So in order to prevent that from happening, these enzymes are stored as precursor molecules known as zymogens. And then within the duodenum, we get activation of the first zymogen. So we get activation of trypsinogen by the action of enterokinase. Enterokinase is a brush border enzyme. And this activates the process of converting trypsinogen to active trypsin. And then the production of trypsin then activates the other zymogens in turn. So in doing this, it prevents autodigestion. So I think that's pretty clever. So what does pancreatitis actually mean? Well, effectively what happens is we're getting that process occurring, but in the wrong places. So we're getting intraductal or intracellular activation of pancreatic enzymes. And that leads to what can be quite considerable destruction of pancreatic tissue. And we can also get edema, hemorrhage, and necrosis. Now, my surgical skills are poor, but just to make you aware that the picture on the right-hand side of your screen is in fact a post-mortem image, which is why obviously there's no sterile field. But here you can see a rather unpleasant looking, somewhat nodular pancreas in this particular dog. So there are two primary types of pancreatitis. We have either acute or chronic. Now, acute pancreatitis, as the name suggests, it occurs abruptly, but more importantly, it reflects the fact that the treatment or the condition itself should be reversible. So it should be inflammatory, but it should be reversible with treatment. It can, of course, lead to chronic pancreatitis due to cell death and acute necrotizing pancreatitis, which can be life-threatening. But ultimately, an acute pancreatitis is something that should be reversible. Compare that with chronic pancreatitis, and this is an inflammatory disease which is progressive, and it often is accompanied by irreversible changes to the pancreas, including what could be fibrosis. Further flare-ups may occur, resulting in further episodes of acute pancreatitis on top of that. So the condition should often be manageable with close monitoring and dietary discretion, but ultimately chronic pancreatitis is something that's accompanied by irreversible changes to the pancreas. So just for interest, say this was a study in cats, but I still think it's relevant. A necropsy study of 115 cats, including 45 apparently healthy cats, revealed an overall prevalence of 67%, of which 45% in healthy cats, and chronic pancreatitis 76.3%, and acute pancreatitis 9.2%. And the presence of both chronic and acute pancreatitis in 15%. So this study nicely shows the high prevalence of pancreatitis and that it is possible to have pancreatitis even in apparently healthy animals. And other cadaver studies have been done in dogs which show similar information. So we need to think about our signalment and prevalence of pancreatitis. It tends to be something that we identify more in middle-aged to older animals. However, I certainly wouldn't rule out the possibility of pancreatitis in a young animal with compatible clinical signs, especially, for example, a young dog who has a history of eating a high-fat meal or getting into the food waste or raiding the bins, for example. So young dogs can get pancreatitis, particularly if there's been a history of raiding bins or high-fat meals. There's no sex predisposition with both males and females, both being equally affected. And there may be some breeds that are more predisposed, including breeds such as miniature schnauzers, Yorkshire Terriers, and poodles. I'd perhaps also include Cavaliers in there too. And we do find it's more commonly identified in obese patients, as being overweight tends to be a risk factor for developing pancreatitis. And studies have been done on cadavers to see the prevalence. But we can see from recent necropsy studies that greater than 90% of cases are undiagnosed. So that does mean that we're going to miss a lot of cases unless we're looking for them. And even if we're looking for them, unfortunately, we might still miss them. So a lot of cases undiagnosed, And we need to have an open mind as to whether pancreatitis remains a differential diagnosis and be looking for it in our canine patients. So what are the risk factors in dogs? Well, many cases of pancreatitis may be idiopathic in nature, but there are some accepted risk factors that are believed to increase the likelihood of developing pancreatitis. And these include things like hypercalcemia, things like blunt force trauma, where the blood supply to the pancreas may be compromised, leading to ischemia, for example. But we also get some drugs being associated as risk factors. So if the animal takes potassium bromide for seizures, or if it's on azathioprine for some form of immune-mediated disease, or even more what would apparently appear to be benign drugs like furosemide can stimulate pancreatitis, and sulfonamide drugs, which are less in use these days, L-asparagine, which is sometimes used in protocols for chemotherapy, and even zinc toxicosis. So drug history has to be relevant when we're looking at a case of suspected or confirmed pancreatitis to see if we can find a trigger. Because obviously if we can find a trigger and we can remove that trigger, there's a greater chance that the animal will do better in the future with fewer further episodes of pancreatitis. Also, endocrine disorders have been linked with pancreatitis, particularly hypothyroidism and hyperadrenocorticism. And we do know that hyperlipidemia, particularly an increase in triglycerides, can be a factor in causing pancreatitis, and this may even be familial in the miniature schnauzer. But in many cases, we don't have a clear etiology. So clinical signs in dogs typically reflect the gastrointestinal tract. So we have anorexia or dysrexia, vomiting, perhaps the animal's weak, associated with the fact it hasn't eaten for a while, often abdominal pain, which we can often localize to the cranial abdomen, and subsequent to that, dehydration. But some animals may present with diarrhea as well. So diarrhea remains a possible clinical sign associated with pancreatitis. Mild cases can be difficult to diagnose because they might not have this full spectrum of clinical signs. And as I've mentioned, it is an underdiagnosed condition.